Check that out. Or are we wrong today?
45 seconds.
Good afternoon. Before I get started, I did want to give an update on some of the weather that went through the state yesterday evening. I want to acknowledge that the communities that were impacted with the severe weather that we had yesterday, a tornado did cause damage in Iowans, including an apartment building, where 12 families were impacted and are being assisted by the Red Cross while damage is being assessed. A farm in Adair County also sustained some damages due to the storm, and we are just grateful that these families are safe and we will assist them in their recovery. Now for an update on the numbers of COVID-19 cases in Iowa. We had 38 new positive cases today for a total of 336 positive cases, 638 negative cases today for a total of 5,013 negative tests. We have 51 hospitalized as of last evening, and I am so sorry to report that we have had one additional death for a total of 4. The test available for individuals through the State Hygienic Lab is 840. As we continue to increase our capacity for testing at the State Hygienic Lab and other labs, more tests are being ran on a daily basis, resulting in higher numbers in positive and negative results. Over the last 2 weeks, we've taken significant steps to mitigate and slow the spread of COVID-19. We've recommended schools closed for 4 weeks, reduced gatherings to 10 people or less in social, community, faith activities, recreational, leisure, and sporting events. We've encouraged work from home when possible and social distancing. Ordered many businesses to close, including restaurants, bars, except for carry-out, delivery, and pickup. Because of the incubation period of the virus, because it is 14 days, we've been expecting an increase of positive cases during this time, and we expect that it will continue as Iowans who have recently traveled for spring break and may have been exposed to the virus are still in that incubation period. It's also important to keep in mind that most people, about 80%, who get the virus will experience only mild symptoms and can fully recover at home with little or no medical attention. Regardless of what age or risk group you're in, it is so important that we all do our part to protect our fellow Iowans. Stay at home as much as possible, even if you're healthy. Limit your time away from home to trips for essentials like groceries, medications, and necessary supplies. If your children or you are sick, stay home. Contact your medical provider before going in. If your job allows you to work from home, do so. If someone in your household has tested positive for the coronavirus, keep the entire household at home. If you're an older Iowan or person with chronic health issues, stay home and away from other people. Today marks 3 weeks since we announced the first positive COVID-19 cases in Iowa. In that time, our way of life and how we do business has changed dramatically here in Iowa and all across the country. And just as Iowa families are adjusting to living and working and learning under the same roof, so are families in every single state. And workers across Iowa and America are facing the reality of suddenly being out of a job and worried about making ends meet and supporting their families, while business owners are wondering when or how they'll reopen their doors. The impact of COVID-19 is being felt coast to coast, and we are responding as one nation. For several weeks, my team has been working with our state agencies, local partners, elected officials, EMA, local public health and first responders, law enforcement, and hospitals and healthcare workers, the Iowa National Guard, the private sector, and other governors, along with Vice President Pence and the President's Corona Task Force. All of this in an effort to ensure Iowa was prepared and ready to respond. I've also remained in close contact with Iowa's congressional delegation, who have been working diligently at the federal level to ensure Iowans and Iowa would have the support it needs. Today, I'm pleased to have Senator Joni Ernst join me from her home in Red Oak to share her perspective of the coronavirus response at a national level and update us on the CARES Act, which the President signed on Friday. So thank you for joining us today, Senator, and with that, I'll turn it over to you.
Great. No, thank you so much, Governor, and I do appreciate your leadership. It's truly a tremendous job supporting and working for the people of Iowa and working with those of us at the federal level as well. And first, what I'd like to do is update you. I'll go through the various packages that we have passed at the federal level, and all of these items will, of course, help Iowans. That is our goal. Senator Grassley and I worked diligently and at quite a rapid pace to get the first package done. That phase one bill, which was dollars, about $8 billion or more, that was allocated to go to federal, state, and local partners, and of course our healthcare workers, and making sure that those dollars were flowing into those systems. That was phase one. Phase two, then, of course, we moved on, and that was very much focused on providing free testing for the COVID-19. That is the diagnostic testing that the governor was talking about, and access to food and nutrition programs for children and seniors. And then a significant part of phase two was also making sure that our workers, our moms and dads, had paid sick leave, emergency sick leave, so that if they were affected by the coronavirus, then they would be covered for the time that they had to take away from their employer. Now, phase three is the CARES Act that the governor was referring to, and that is the most significant package that we have had, and that is what the president did sign on Friday without delay. And so I've got a number of notes here. I'll go through some of the various items that were passed as part of that package, and certainly I'll be available to take questions as well after this. But phase three, what we really focused on, a couple different areas: individuals, workers, and families, kind of in one bucket. And with that, we do have direct payments that will go out, and hopefully that will be done here in the next several weeks. The direct payments from the federal government for those individuals that are making $75,000 or less, they will see that maximum payment of $1,200. For a couple, if you make $150,000 or less, then that maximum payment would be $2,400. And again, those are the direct payments. And we also have expanded unemployment insurance by $250 billion as well to support our workers, those that have been laid off due to the coronavirus. And all of that will go out to the various states. Another group are seniors as well. What we did, we expanded Medicare telehealth services. We know that our seniors still require various appointments, but they are part of that vulnerable population. And so we are providing dollars to help expand not only the telehealth services, but then the portion that Medicare would pay for those types of visits over the phone or over the internet. So that was a tremendous step forward. We also are providing dollars for the COVID-19 vaccine. So that's a future effort, but we wanted to make sure dollars were allocated for that. There's $955 million that has been provided for the Aging and Disability Services Program, which is very important. They provide home-delivered meals, things like Meals on Wheels, as well as disability services and family community-based services, family programs. and for caretakers as well. It does require Medicare Part D to provide up to a 90-day supply of prescription medication for seniors if they are worried about the COVID-19 and they don't want to get out to their pharmacist. It does require that Medicare Part D cover that cost of those prescriptions and allow for a 90-day prescription. So it's a great step there. And for our seniors as well, one thing that I fought for, of course, at the request of many of our seniors across the state, is to make sure that they were included in that direct payment as well, even if they haven't paid into the IRS in the last several years. They will still be included as long as they meet those income requirements. Another group, the healthcare workers and hospitals, we wanted to make sure that they were properly protected. That has been one of the largest topics of interest, I think, across not only Iowa, but the United States as well, and making sure that our healthcare workers and those that are on the front lines working with individuals that might be infected, making sure that they have the proper protective equipment, their personal protective equipment. So we have $10 billion that is going into, or excuse me, $16 billion that's going into personal protective equipment, ventilators, and so forth for medical supplies, and that is through our strategic national stockpile. And then something that's very important to Iowa is the community health centers, and they are spread out through our rural area and cover a lot of the essential services that our Iowans need in those rural areas. We have $1 billion going to those CHCs. Senator Grassley thought that was very, very important. And then it allows our rural health clinics and federally qualified health clinics to also expand their telehealth services, which is something that I addressed as part of our seniors package as well. And then, of course, a package that I worked on with one of the task forces was small business and nonprofits. And what we have done there, we have provided opportunity through the Small Business Administration for emergency type loans or loans to help small businesses stay open, stay viable through this epidemic or through this pandemic. And it provides these loans through the local lenders. So your credit unions, your local banks, they will be able to lend those dollars to our small businesses. It will be 100% backed by the federal government, however. So what we're trying to do is eliminate red tape where we can and make sure that that the local banks are able to provide those services. It'll be much easier, much faster for our small businesses. The use of these loans, too, can be used for a number of different areas, whether it's operations, payroll support, benefits. And if that small business or that employer retains the workers or rehires those workers after the pandemic, then those loans can be partially forgiven. We felt that that was very important as well. And we have a lot of small businesses, just as the governor said, through this pandemic, and just here in the first several weeks, we've seen many of those small businesses close, and we want to make sure that they're taken care of. The ag community, our farmers and producers are going to also receive direct assistance and emergency support. And what we've done is provide additional funding for our inspectors, our USDA food inspectors as well. This is a concern that many people have had is with coronavirus, is the food supply chain, is it safe? So yes, we want to make sure it is. And then what we've done, something we heard from a number of Iowans that produce alcohol in our various distilleries, they have been concerned. They would like to help out support where they can. So what they would like to do is produce hand sanitizer and various types of alcohol-based cleaning products. But there was an excise tax that was involved in that discussion. And so what we were able to do is eliminate that excise tax for those that are converting their alcohol into hand sanitizers and various types of products like that. And then we also have increased funding for commodity purchases, which will not only help our farmers through those increased purchases through commodities, but it also helps our Iowa food banks and those community food programs. So we felt that was very important. But again, folks, this package was about $2 trillion, $2 trillion plus. And we felt that it was so important to get done to make sure we were supporting Iowans and, of course, every community across the United States that's going through this pandemic. And so we did get that done. I'm so glad that the President was able to get that fund on Friday without delay. We will start seeing those programs kick in then here at the local level very soon. And so, again, thank you, Governor Reynolds. It's such an honor to be included as part of today's presser. And I want to thank everybody for joining the call. I know this is on our hearts and minds, and no matter where we are. So thanks so much for allowing me to participate today. And I'll look forward to taking questions when the time is appropriate. Thank you so much, Governor.
Thank you. Thanks, Joni. I appreciate that very much. Appreciate the work in Washington on behalf of all of us and that overview of what's included in the different packages that have been signed and gone out from the federal level. We're going to continue to work at the state level and get Iowans the information so they can understand how the state and the federal packages work together to make sure that we're meeting the needs of Iowans during this critical time. I also, just before we wrap up and take questions, and I believe Senator Ernst is going to stay on the line, so if you have a question for her, she'll be available for that as well. But I want to take this opportunity to thank the many people and businesses who are making a difference, whether it's through individual acts of kindness or by offering solutions that will impact many. I'll give you a couple examples. Mid-American and Alliant Energy both donated thousands of masks for healthcare providers. Under normal circumstances, their technicians use the mask when working in client homes, but both companies wanted them to be put to better use at this time. So again, thank you for answering this critical need. The Department and the Department of Corrections and the Iowa Prison Industries are producing hand sanitizer, critical PPE items, including masks and gloves and gowns that will be distributed through our state stockpile to healthcare facilities and state residential facilities managed by the Department of Human Services. And during tomorrow's press conference, we're just teasing you a little bit with a couple of good things because we're going to be highlighting many, many more examples of how the private sector has really stood up to retrofit and really work with people across the state to help us address some of our PPE concerns. So Iowans are always willing to lend their hearts and their hands during these times of needs, and I just want to say thanks for your generosity. You certainly make us proud, and I look forward to letting Iowans know a little bit more about those amazing stories that are happening across our state tomorrow. So with that, we will. I'll go ahead and open it up for questions.
Governor, before giving your order that included abortions as an elective medical procedure, did you receive medical expert guidance on that, or was that a decision made on your personal ideology?
So, no, it was not. The proclamation suspends all non-essential and essential surgery procedures until April 16th, and we believe that that does include surgical abortion procedures. The decisions that I have been made in the vein of really helping us strategically use our PPE stockpile that we have. That has been an issue from the very beginning of this. I believe at every press conference I have stated that the two things that we really are worried about that is making sure that we have the personal protective equipment to take care of those Iowans who are on the front line serving Iowans and those in need, as well as our first responders, and then just the workforce to make sure that we have our health care providers and our first responders healthy so that they can take care of Iowans. And, it's the same thing that I've applied to everything. So, like, for instance, I didn't close down bars and restaurants to go after the hospitality sector. I did that because we felt that that was a area where we could, we would have potential spread. Based on data, we made the recommendation to close down bars and restaurants except for delivery, pickup, or carry out. We didn't make the decision lightly to recommend shutting schools for 4 weeks. We did that again because we wanted to bend the curve, and so we didn't overwhelm our healthcare systems and really help spread this out so we could, again, preserve the personal protective equipment. I didn't suspend churches and gatherings of more than 10 to go after our faith community. I did that, again, as part of our metric and our strategy in helping to protect our most vulnerable, to make sure that we could slow the spread, to make sure that we could protect the PPE and that we could get through this pandemic sooner rather than later. Everyone is making sacrifices, everyone. And so this is a decision that we're making on a daily basis, and that was no different. And one of the things with the non-essential and the elective surgeries is because ventilators are a real concern of ours, anesthesia machines can be tweaked so that they can be used, converted, so that they can be used for ventilators. And by ordering that order, that will free up a significant amount of ventilators or anesthesia machines that will be able to convert to ventilators. And as you know, and you hear on a daily basis, they are in short demand. And as we see the numbers continue to escalate in New York and some of the hot spots across the state, we want to make sure that we're able to take care of Iowans if we get to the point where we have more and more Iowans that require that service. So that's what goes into making decisions. It is, again, it's based on data, it's based on recommendations, it's working with the experts. And you know, these all have a limited time frame. But again, if we do what we need to do now, then hopefully we'll get through this and we'll get things back to normal sooner rather than later.
I guess just really quick, just to follow up on, I don't want to harp on it, but I think you'll get pushback and disagreement on people who consider that, elective or non-essential. You'll have a lot of people say abortion is not, it's something that's optional or elective.
Well, I just asked it. We kept it broad. I didn't specifically address everybody. We kept the language broad. So if they have a question, any of the, does a kidney stone apply? There are those kind of questions that are happening with everything. When we hold a church service, can I still gather with 10, or does the facility close down? I mean, with every one of the directives that we've made or every one of the orders that we put in place, there are questions. So I guess if they have questions, the Board of Medicine would be the enforcement or the oversight for this. So as people have questions, that's where they can go, and then they can, maybe get the answers that they're looking for. Yep, yep. Well, it changes by the hour sometimes and by the day. So we have the strategic national stockpile that we're able to pull from. We have our own that we have here. We have asked our hospitals and the healthcare providers. They're also ordering from their vendors. So we continue to collect that data. We've asked that's a hospital association, I think, that's collecting a lot of the data. So we're hoping tomorrow they're reaching out to their hospitals, collecting the data. We're putting that together so we can streamline that, and I think hopefully next week have a better method to where we can show you kind of where we're at and what's coming in. But every day we talk about the orders that have been placed and the orders that are coming in, what the timeline looks like. We have the National Guard that are doing anywhere from 26 to 30 plus missions every day. I think they've been in almost all 99 counties making deliveries. It is almost a real-time delivery as the supplies come in. They're loading them up and they're delivering them. We have a system that we run that through so that we can identify where some of the most critical needs are, so that we make sure that we're prioritizing the supplies to those who need it. So there's a big system in place that we're working through, but hopefully once we get the additional information that we're looking for, same thing with the anesthesia machines and the ventilators. That's information we're also gathering from the hospitals and through the hospital association. So we should have a better idea next week of what those numbers look like. They're working with their hospitals and other healthcare providers to get that information.
Last question in the room before we go to Tom.
Governor, among all the businesses that have been recommended for either partial or complete closures, big box retail stores like Walmart, Target, Hobby Lobby have not been. Can you just kind of talk about the decision, the balance you've tried to strike there? Because those stores have groceries and
that's why.
Things like that, but they also are a place that a lot of people go, and so there's the risk of spread.
Yeah.
To that.
So we have, as individuals, we also have to be responsible, and so we have to know to practice social distancing as you're going out. I've said in my opening remarks, keep those trips to a minimal. Make sure that you're sending one person at a time so you don't have a whole family going out to the grocery store or to wherever that may be to pick up supplies. Go every 2 weeks, so don't get 7 months worth, and we've got the supply chain is moving. Our passenger vehicle traffic is down, but our trucks are where they were a year ago, so we're stocking the grocery stores and stocking the shelves, so people should just get a week to 2 weeks supply. But if they have, some of the essential, the groceries, then they're allowed to stay open. And again, as I indicated, we're making these decisions based on data, trying to be as responsible as we can. We also want to make sure that we're protecting Iowans, but we're also looking at the impact that it has on the economy. And so all of this goes into account, but Iowans can be respectful too and keep their distances. And as you're checking out, have the stores, I hope they're doing like every other lane. There's things that they can do also. I know they've taken great steps to make sure that they're sanitizing the carts, and I think everybody knows that they need to be judicious, I guess, in practicing social distancing and doing whatever they can to remain safe. Do you have anything to add?
Grant with Iowa Public Radio.
Hi, I was wondering if you could talk about how the rate of illness compares when you look at the number of Iowans that have been hospitalized, the number of deaths compared to other parts of the U.S. or even other parts of the world.
Okay, so I'm not sure I completely understood the question, so I'm going to start, and then maybe if Sarah has something to add to that. We've tested about over 5,300 right now. We have about 6% that's testing positive. A lot of the other states, that's running about 8 to 9, but there's so many variables, remember, and how many they're testing and where, and I think our hospitalization right now is about 15%.
Next question will be Monica with Channel 13. Go ahead, Monica.
Hi, Governor. I've been reading a lot of, unfortunately, police headlines about doctors now having to make difficult decisions in other states to live or die because they just don't have enough means to save everyone. Iowa, of course, isn't near anywhere, a place like New York City, but, as we've heard Dr. Fauci say, that things will get worse in all other states. How, if any, are we preparing all hospitals, resource-wise, especially those rural areas, for that kind of an emergency? I mean, we were speaking with the doctor in Fort Dodge where they said they would have 8 ventilators. So if and when we get to that point, are they prepared resource-wise? Will they have to face that same difficult position?
Well, again, that's why I've made a lot of the decisions that I've had and implemented a lot of the orders, because we know that the decisions that we're making now, freeze up, mask or ventilators or just professional protective equipment. So that's why the latest round, it was non-essential, suspending non-essential and elective surgeries, because we know that we have an access to some of the PPE that we need by doing that. That's why we have businesses that are standing up and providing some of the supplies that we need. And while it's also why we're reaching out to the private sector to see if they can retrofit their company to make the face shields, and then we can have a different type of face mask if we've got the face shield that covers those that are on the front line, the healthcare providers and our first responders. So we're trying to be as proactive as we can, and also identifying where the resources are at so we know where we need to go if we need to reallocate or get them to a different area. I don't know if you remember, but last week I sat down with the CEOs of the big hospitals and then working with our local public health providers and our healthcare coalitions. We really have asked them to take a look at what it looks like if we hit a potential surge in one area of the state. How do they address that from a regional perspective? What happens if we're at maximum capacity in one of our hospitals? What's the alternative plan? What's the amount of PPE in the regions, the number of vents, the number of masks, the number of gowns, the number of ICU beds, the number of other beds that would be available. And so they are to come back next Thursday with that plan. So I don't know if, like, for instance, right now in New York, I mean, they're going through that right now, and our goal is to get ahead of that. So hopefully, by Iowans doing what I know they're doing, and how we're all collectively trying to flatten the curve and really do everything we can to protect vulnerable Iowans and protect that overwhelming our healthcare system, we won't have to get to that point. But we have to plan for it. We have to know what's in the state. We have to know with projections what we think will be, the potential numbers that we'll need. And so that's why we continue to order every day, and we continue to monitor what's coming in and what some of our other optional resources are. Do you have anything to add to that? Yeah.
Okay. Hang on.
Sorry, Rachel, I think the only thing I would add is I think what you're really talking about is crisis standards of care and asking whether the state has a crisis standard of care plan has been referenced in some other states. And so the answer to that question is that yes, the state of Iowa is working on a crisis standards of care plan. But, really the goal, as Governor Reynolds has described, is to never have to implement that crisis standards of care plan by slowing the spread of the virus in our state.
Nick at the register, go ahead.
Yeah, thanks, Governor. I was hoping to kind of get your general thoughts on the stimulus. You said it does enough to kind of cushion the economic blow that Iowa is facing. I'm going to have kind of a more specific question related to that as well.
Yeah, I'm very appreciative of that. We had a lot of governors that have been on weekly calls, not only working with Senator Ernst and our congressional delegation to make sure that they understood how Iowa was being impacted, what some of our numbers were. Joni talked about different groups that had reached out to her to really highlight some concerns that they have. And so they were able to take that into account and put that into the CARES bill. But I appreciate, it's going to take a while to walk through this and to see, what they've included and how that and what the state has done and how we can stack and really minimize the impact and get people through these next, hopefully, 4 months and get this economy back and going. But Joni, do you have anything else that you would like to respond to that question?
Yeah, absolutely. So we had a number of different groups that reached out to me, reached out to Senator Grassley as we were crafting the different pieces of the bill. And just for example, the Small Business Administration loans are typically only for businesses, but we did hear from a number of nonprofits hoping that they would be able to apply for those SBA loans through their local providers. And so we made that decision to include different nonprofits as long as they're receiving Medicaid, as long as they are providing substance abuse treatment, mental health services, and care for those with disabilities. And so there's a number of different nonprofits now that will be able to apply for those dollars because we've heard from so many different providers. Like here in Red Oak, one of the groups that I've worked with for years and years and years is Mission of Production. Yeah. And they are a great example of a group that takes care of those with significant intellectual disabilities or physical disabilities. And we want to make sure that they're able to keep their workers engaged and with their clients. And so we wanted to make sure they were included there. And then Iowa AARP also reached out to me and really wanted me to push for the direct payments for Iowa seniors because there are a number of them that will supplement their income in different ways, whether it's, I heard from an elderly couple that does bake goods out of their home for farmers markets. Obviously, we no longer have those farmers markets going on or those gatherings. So this is one way for those seniors to help supplement their income as well. So many different groups, our ag groups, and I was on the phone every day visiting with different Iowa groups and individuals, child care providers, teachers, you name it, healthcare providers, and all of that wrapped up into this bill. So we feel that we do have a really good product that will benefit Iowans directly.
Thank you. The non-for-profits is a great example because that was something that we were hearing a lot about at the state level and weren't sure that we had the capacity. So I know that would be one example of how grateful we were that they were able to include that in the federal package. So excellent point.
Next question to the Carroll Times.
Hi, Governor. The map that the Department of Public Health updates on its website shows, as far as I know, where infected people reside. It might not show where they work, possibly in a different county with no known infections, like many of the counties out here in western Iowa.
Yeah.
Do you think the map accurately portrays the spread of the virus, or do you think us out here in western Iowa perhaps have a false sense of security and should assume it has spread farther? And also, when do you expect infections to peak?
So I'll start. I know that we are able to track the number of tests that have been given, and we have been testing in all 99 counties. So some of them have just been fortunate enough not to have a positive, and so maybe that's something down the road we can start to show if you're not already. But we had asked the same question actually to see if people were getting tested across the state, and they are, and so it does reflect just the positive test. Do you want to talk a little bit about peak? The governor's right. We are conducting tests everywhere. I think, it should be every Iowan's assumption that the virus is currently circulating in their community. And so, although I know we all stand up here and stand like a broken record, but those mitigation strategies are so very important regardless of where you live in Iowa at this time. As the governor mentioned in her opening remarks, we do anticipate to see our case counts continue to climb. And so I think that we're thinking that we might see a first peak in the next 2 to 3 weeks. So that's the best information that we have right now. I would reiterate that things are changing on a daily basis, and we continue to look at numbers both here in Iowa and what's happening in other states. So that certainly could change, but that would be our best estimate right now.
Second to last question, we'll go to Kathy Obranovich.
Hi, Kathy.
Hi, so I wanted to ask both the governor and Senator Ernst if there is a fourth coronavirus package to come out of Congress, what would you see your priority for that? I realize that the third package is, just barely signed here, but are there priorities that you need in this package or things that you really want Congress to still consider for a fourth package?
So as I said, I have my team looking at that this week. It was just signed on Friday. We had some indication of what would be in there as we look at what, how we bring this economy back on and what we need to do in the interim. So I'll be meeting next week with my financial team, and we'll actually walk through that and see how that applies to the numbers that we're seeing, the unemployment numbers that we're seeing. We'll be bringing Beth Townsend in, I think, every Thursday to give an update on that. And so we'll get a better sense of that, and then with Department of Revenue, with Director Paulson, to see what some of those numbers look like coming in. And then, of course, we'll, at that point, be in close contact with the congressional delegation to see where we might see some gaps and some shortfalls. But I don't know if I want to speculate at this point until we have an opportunity to go through that.
Yeah, Kathy, great to hear your voice. And I do anticipate that there will be some discussion about a phase 4 package. We're not sure yet if that will be needed. If it is, certainly we will be acting on that. But some of the priorities that I would like to see continued in that phase 4, of course, support for our small businesses as necessary, and those unemployed workers, but then also the healthcare system, and making sure that we are investing properly in vaccinations and making sure that we are also developing plans for future possibilities of other pandemics. So this is the first one we've gone through in recent history, and just making sure that we're thoroughly evaluating what we have done in phase 1, phase 2, phase 3, and then how can we be better prepared as a nation, God forbid, if this should ever happen again, just making sure that we're capturing all of that data.
Yeah.
So just a few things, again, focusing on the healthcare system, those individual workers, and our small businesses.
Yeah.
I think that will be the priority moving forward. You've heard talk from some other states, though. They would like to see additional local government assistance as well as state assistance, and that, to me, is something we will debate. We will see, as long as it's COVID-19 related. we will have those discussions coming up for phase 4.
Yeah, I think the point that you make too with our healthcare systems, they are stepping up through all of this, and so I know we were able to get some funding in this last the CARES Act. There was some funding in there, but that is probably something we'll have to take a look at. And then it is more forward-looking as the conversations that we've had of how we address this going forward.
The last question is going to the Cedar Rapids Gazette. Brian.
Okay, thank you, Governor. I wondered if there's any additional information you could provide about the person who unfortunately passed away in Lynn County. For example, do we know, were they being treated in the hospital? Were they at home? How long were they experiencing symptoms? If there's anything else you could share, please do so. Thank you.
Do you want to give that?
I think the only information that we would share at this time is it was an older adult who was a resident of Lynn County.
Okay, thank you. Thank you, Senator, again for being with us today and giving us an update. I appreciate it very much. Thank you.
Yeah, thank you for your leadership, Governor, and for everyone. Stay safe, and please stay strong.
Thank you.
Through this.
Thank you.
Thank